Hi everybody, it's Corey Goldberg here. I am often asked about scars for facelifts. Facelift scars are generally positioned in places where they're hard to see, and it also happens that the face skin and the head and neck skin in general heals impeccably well, better than any other part of the body in fact. So as a result, the facelift scars are very acceptable and really hard to visualize. It's important to know that scars are permanent no matter where they are and what type of scar they are, and as a result, no matter what kind of surgery you're having, you will have a permanent scar. But the key to the facelift scar is making sure that people can't see it, and that comes down to proper planning and good suture techniques. Ultimately, scars will take about a year to mature after any kind of surgery, and this is the same for a facelift. Usually by about 6 months after a facelift, the scars are faded and very light, but there would still be a little bit of a pink color, but then eventually they'll fade away and become thin white lines. The positioning of facelift scars includes in front of the ear, behind the structures of the ear in the middle portion, and then curving in behind the ear in the valley behind, going towards the hairline. Now some surgeons will extend this in either direction, sometimes going up onto the temple or back into the hairline towards the back of the head. I'll sometimes extend scars in this direction, but I do my best to minimize this. What most people would consider my technique is what would be called a short scar facelift, which means that I generally don't extend very far away from the ear. Extending the incision back behind the hairline can sometimes help tighten the neck further, and this may be necessary, but it can also shift the hairline, and that can be a visible way of telling that someone's had a facelift. Same thing in the temple. One needs to be very careful planning those incisions because that can shift the hairline there too. And so, as with any discussion about a facelift, it's really important to tailor this to your specific needs, and so incision planning and deciding where to put incisions is different for every patient. This is something that you should discuss with your surgeon before proceeding with a facelift. Wishing you all the best and hope to see you soon.